Hi there, my name is Luca Hill from Infinity Canine, and today I'm going to be going over how to do cooperative care for a blood draw with your dog. Cooperative care, also known as collaborative care, centers around creating a positive conditional emotional response with our dog related to different healthcare and grooming procedures. What that means is essentially that we are going to build a good association with things that our dog needs to have done, such as a blood draw or vaccinations or even a routine health check. We do this by pairing those procedures with something the dog naturally finds very enjoyable so that those good feelings transfer to the experience. We are also, in this process, gradually desensitizing them, building up a tolerance in a way. What that will look like is that we're going to start really easy with very minimal interaction, and we're gradually going to build up the intensity as the dog is comfortable. Cooperative care also helps us to be able to communicate better with our dog because, as you'll see, if the dog moves out of position, that is them giving us a very clear sign that they're not comfortable, and therefore we have a much more clear form of communication that even someone who's not super dog savvy is usually able to pick up on. So in this scenario, what we're going to be doing is that Isla's going to be in the middle position where she's sitting between my legs, and she's going to maintain that position while I do a blood draw on her front leg. Now, of course, I'm not actually going to be doing a blood draw. I'm going to be using an oral syringe instead of one that actually has a needle on it, and I'll be pressing air through onto her fur just so it has some sort of sensation behind it. So what I'm going to do first is that I'm going to show you what Isla looks like before we start with our conditioning sessions. Isla, through. Yes, good girl. Okay, breathe. Good job. So as you can see, she's actually not too terrible, but she is a little concerned about what's going on. She has a lot of staring at the needle that I'm using, and she also, that might have been difficult to tell, but she wasn't fully relaxed putting her leg out. You can move position if you like. Isla really likes this position, so this will hopefully help her feel better about the blood draw that we're doing. So what I'm going to do to help her start feeling more comfortable is I'm first going to build a CER, conditioned emotional response, with the equipment itself. So I'm going to show her the syringe and then mark a reward for her investigating it. Yes, good job. That's not where my treat is. Get it. If she wants to stay in this position, she's allowed, but she doesn't have to during this part of the training. Oh, you're still chewing. My bad. Yes, good job. It's good to keep in mind as well, depending on what the equipment is, you may not want to let your dog come up and sniff it. For example, if you are getting them comfortable with scissors for grooming, you don't really want your dog touching their nose to that because they could get themselves cut if they get too comfortable with it. So just looking at it can also count. Yes, in this case though, it's okay for her to touch it. Good girl. Now what I'm going to do is, now that she's okay with the equipment itself, I'm going to move on to the actual handling part. So I'm going to first just touch her leg, yes, but keeping it on the ground. Now she did lift it a little bit. It might have been difficult to tell. She was not pulling really away from me. She more was trying to lift it, I think, maybe to help me because we have worked on her willingly giving her paws for cleaning her feet and such like that. Oh, these are some chewy treats, aren't they? So my goal with cooperative care is to gradually build up that intensity. So I'm going to touch it, yes, and hold it for a little longer. I'm just going to build that up first. You may want to switch treats because these are quite difficult to chew. Or break them up, maybe. Or break them up, maybe. Yes, good job. And when she's okay with me kind of touching and grasping her leg a bit, I'm gonna lift it very briefly and then put it down. Yes, good girl. Gonna build up the duration of me holding her leg at that level. Yes. I'm marking and rewarding after she's comfortable with that. If at any point she does get uncomfortable, I'll stop, I'll back up, and I'll go a little slower, going back to where we were last successful. Yes, good girl. Okay. Now I'm gonna work on extending her leg out after she finishes chewing. Yes, good. We're getting a bunch of different textures with these treats, huh? Hi, good girl. Yes, good job. That was very good. Yes, good job. And it might be difficult to see, but she is not resisting me anymore like she was before. Hi, good girl. Good job. Yes, good job. I'm gonna try to get her to the point where I can hold it like that for 10 seconds. Right? Yeah, and if she breaks position like that, that is okay. A bug did just fall from the ceiling, so understandable that she wanted to investigate that. Um, but I will allow her to break position and then give her a moment to reset. I'll toss a cookie for her. Not this whole thing, that's a big one. Get it. And then when she willingly comes back over to me, I'll reset her and we'll keep going. Ready? Not that way, silly. Wrong way. That's the wrong way. Yes, there you go. You're a goof. So I do want to keep an eye on that, make sure that's not her saying that she's not comfortable and she's not ready. So I'm gonna try and touch her. Yes, good girl. Watch her body language, and as long as she seems comfortable, we'll proceed. She seems good. Good girl. Yes, good job. That's great. Do you like to encourage some eye contact during this? But as long as she seems comfortable, that's really what's important. Yes, good girl. I can tell she's a little confused about what I'm doing, but she's comfortable, and that's what's important. Good girl. Yes, good job. So that's up to 10 seconds, and she is giving me eye contact. There's no resistance in her extending her leg. I'm just going to do that once or twice more, and then we'll move on to palpating for the vein. Yes, good girl. Good job. Good girl. All right, so I'm gonna extend the leg and then I'm just gonna do a little tap. Yes, good. This is mimicking them finding the appropriate vein to take the blood from. Good girl, yeah. The fact that she continually keeps looking at me, checking in with me, is really great. For her specifically, I know she does not like it. Good girl.